kidneys are very vital organs, but their warning signs are often very silent. So, on today's video, we are going to reveal the early and dangerous signs of your kidneys problem that you should never ignore. Don't miss this potentially life-saving signs. Now, each of us have two kidneys. Some people have only one kidney, and the kidneys filter around 50 gallons of blood every single day. They regulate your body fluid, control your blood pressure, and even remove waste substances from your blood. But here's a catch. Kidney damage often happens silently, and most people do not know the symptoms until it's too late. So on today's video, I'm going to reveal some of the symptoms and signs that you should pay attention to if you have them, because an early recognition of this sign can save your life. The first symptoms that you should pay attention to will be the swelling in your ankles, your feet, and hands. Now, this may be a sign that your kidneys are struggling to eliminate excess fluid from your body. The second sign that you should pay attention to is changes in your urination. Any changes in your urination, from frequency of urination, that's you're going more than usual, or you have a foaming or bubbles in your urine, okay? Or if you have blood in your urine, or you have frequent nighttime urination, especially in men, or your urine tells a story, there's a sudden change in your urine, or you have what we call you're producing less urine than you should, because usually under normal circumstances we should produce about 30 mLs of urine per hour. That is the minimum we should produce per day. And so if you're producing, that means almost around, so you multiply 30 by 24, that's 720 mLs of urine per day. So if you have a significant decrease in urination, this could be a sign that you have a kidney disease. What about the next one? Persistent fatigue. Now, when the kidney fails and water builds up, you have a drain of energy and people just have persistent fatigue. That could be an early sign of a kidney disease. The next one is difficulty concentration or having a brain fog. Now, when the toxic substances build in your blood because the kidneys are not able to remove those toxic substances, that can give you a brain fog or difficulty concentration. So if you're experiencing any of these, that could also be a sign that you have kidney disease. Now, what about difficulty having shortness of breath, difficulty breathing? Now, difficulty breathing is to be one of the signs, because what happens is that the kidneys is not able to remove the fluids. So fluids build up in your lungs, and that can cause shortness of breath. Or just kidneys also produce what we call the red blood cells. And so by not being able to produce red blood cells, you can have severe anemia, which can cause shortness of breath, which could be a sign of a kidney disease. Itchiness and dry skin. Itchiness and dry skin can come from the mineral imbalances due to poor kidney function. And so you have itchiness and dry skin, that can be a sign of a kidney disease. The next one that people don't pay attention to is nausea and vomiting. Now, the body tries to expel toxins from the body. So when there's a buildup of toxins in the body, what's going to happen is that you could have persistent nausea and vomiting that you may think that is from your stomach. And people start treating for GI stuff, but actually this could be your kidneys. The other one that you should pay attention to is a metallic taste in your mouth. This is because ammonia builds up, or uranium, we call that. It builds up in your blood because the body is unable to clear these toxins from your body, and therefore leading in that metallic taste in your mouth. High blood pressure. You just cannot control your blood pressure. Why? Because you have a kidney problem, because the kidney help regulates your blood pressure. So when you are struggling to clear blood, you are struggling to be able to control your blood pressure, having been on multiple medications, it could be a sign that you're having a kidney damage. So you should pay attention to this. Low back pain, yes, that can be a sign of a kidney problem because the kidney is it lays in the portion of your back where sometimes when you have pain around that area, it could be a sign that you have a kidney problem and you should pay attention to it. It's so important that when you experience two or more of the symptoms that I just talked about consistently, you need to go in and get checked by doing a simple blood test we call basic metabolic panel. And if you do that, or you just do a urine analysis, you'll be able to really recognize an early kidney damage and therefore be sent to a kidney specialist on time to help you to what? To save your kidney. Because the kidney is the organs that if you begin to drown, your whole body is going to drown. Now, don't wait until it's too late to be able to protect your kidneys. So, what I want to tell you is that you need to stay hydrated, limit a lot of salt intake, and also avoid overuse of painkillers that can cause kidney damage, like the NSAIDs. They can cause kidney damage. So, what I want to do right now, I want you to subscribe to my channel, give me a like, and also spread the awareness to people because you never know who is going to benefit from this video. Comment below if you experience any of these signs and you're able to recognize it on time to be able to save your kidney. But this could help our viewers today. Until then, I'll see you on the next video. And again, subscribe to this channel if you've not, and also give us a like. I'll see you again.